To begin with, I just want to do what I often do at this point in the proceedings and just pass on some thanks of mine. First of all, I would like to extend huge thanks to my wonderful team at Amati, who we have an unusually large number of present with us this year, probably more than we've ever had. So Rachel, who many of you will have met, who's our head of sales and who organises this event, many thanks to Rachel. Sam Dolby, who works in Rachel's team, two of our regional sales representatives, Carol Cunningham and John Woolley, both here for the first time, and fantastic to have you with us. We have our compliance officer here, if anyone would like to ask him some questions later, Andrew Lynn, and our finance director, Ali Clark, is also here, and of course my colleague, fund manager, Anna. So many thanks to you all, and equally a huge thank you to the board of directors, who sadly we only have three of them with us today. And even more sadly, we're saying goodbye to Mike, who I want to express my gratitude and thanks to personally. And Mike has been involved in this. Those of you who followed Amati for a while know that at one stage we had managed 3 VCTs, but the one that Mike brought us into contact with was called Victory VCT. And Mike was a long-standing director of that VCT. And I just want to say that Mike's what one might call good-humoured precision and unwavering ability to get to the point will be much missed, as will Mike was for a long time involved in the Falkland Islands holding company and has told us many wonderful stories about what happens on the Falkland Islands, and this will also be much missed. So thank you very much, Mike, for all you've done for us. Now, before proceeding, I wanted to issue a little bit of a health warning, which is, I suppose, to say that this presentation may contain nuts. And I suppose what I'm really trying to say by that is that I'm really going to do my best not to mention Brexit. But I'm going to try and talk about a few other things which are a little bit off-piste. And forgive me, maybe this is a bit self-indulgent of me to do this. Last year, when those of you remember last year's presentation, I talked about the impact over the last decade. I was trying to explain really why the Small Companies Fund and the VCT had really done particularly well over a 10-year period. And I was talking about the industrial revolution in digital technology and how, if you like, we've been in a 10-year golden age, which is called by the economist Carlota Perez, who writes about industrial revolutions, the implementation phase of an industrial revolution. It's quite far on in the process. It comes after all the discoveries and the initial excitement, comes after a crash, and it comes when the technology is mature enough to really be put into industrial action. That's the implementation phase. And I think that has a lot to do with why we've had some incredibly successful investments, and they are playing into this theme. And so really what I wanted to do this year was talk about the sequel to that, because in some ways it's not quite as simple as that, and in other ways there's another story to tell, and as is so often the case, unfortunately, the sequel is always a little bit darker than the original. And so I'm going to just put up my first slide here, which this is the title of a book by an American author called Roger McNamee. And what's interesting about Roger is he was the personal advisor to Mark Zuckerberg for about 3 years. And he is a very, very long-standing Silicon Valley investor, so he really has a lot to say about the world of digital technology and the whole Silicon Valley explosion that's taken place over the last 30, 40 years. And interestingly, from 2016 onwards, having been a huge proponent and advocate of what's been going on, he became, if you like, a bit of a canary in the coal mine and started ringing an alarm bell, which I've listened to a rather wonderful 2-hour interview with him, which I can point you to later if you're interested, or you can read this book, which goes into detail of his arguments. So I thought it was just worth explaining a little bit about his arguments and what's going on here. So to quote from Roger, this book here, just to kind of give you the flavour of what he's trying to say, and the subtitle, in case you can't read it, is Waking Up to the Facebook Catastrophe. So what does he mean by that? And near the introduction, he's saying, it is possible that the worst danger from Facebook and the other platforms is behind us, but that is not where the smart money will place its bets. The most likely scenario is that the technology and business model of Facebook and others will continue to undermine democracy, public health, privacy, and innovation until a countervailing power in the form of government intervention or user protest forces change. And it's a pretty big statement. And I think it's just valuable to A, hear this argument, and B, try and understand why would somebody in this position be making this case. There are two incredibly data-rich, global dominant players in the world at the moment. Facebook is obviously one. The other is Google, and in particular with, Google gets our data from more sources than we can possibly imagine, but the one which we probably interact with the most is YouTube. And so I did a little experiment for this where in order to kind of characterize to you what this critique of the data giants involves, I watched a video, I searched for a video on YouTube of Roger McNamee and to see what would come up, and some interesting things come up when you do that. And these are just, those of you, I imagine everybody has used YouTube at some point in recent years. And when you look at a video, you watch the video, but importantly what happens is on the right-hand side of your screen, Google's wonderful algorithms select some things that they think you might be interested in watching next. And this is really where the essence of what's going on in terms of YouTube comes. Obviously with Facebook, if you're a user of Facebook, and I'm not really a particular user of Facebook, but if you are, when you're reading lots of things that you're interested in, chatting to your friends and following what they're doing, Facebook will select some things to put in there that they think you might be interested in. And this is really where this question, which I've asked at the top here, publisher or platform, it's one of the most important questions of our age, and it's one of the most important questions for the whole industrial revolution in digital technology. And this is, I'm just trying to give a little bit of illustration of how this works. So I searched for a video on Roger McNamee, and here, the first one that kind of comes up here, beyond an advert, which I didn't put up on the side, the first thing that comes up is an advert, which I didn't want to repeat because I'm not in the business of advertising here. But below the advert, the first one is a relevant video. It's another Roger McNamee video. And let's say, so this is, I'm trying to do some research on Roger McNamee. This is important. But it's interestingly, it's of these top 7, it's the only one that's remotely relevant to Roger McNamee. The second one here is an advert, so Google paid to show me that. The first thing I noticed about it was it had 16 million views, and I thought, oh, well, maybe I should watch that. Everyone else is looking at it. I wouldn't have noticed this little orange thing here, which is telling me it's an advert, probably, before I clicked on it. And I thought, oh, well, these two look quite interesting. Why don't I click on that? If I did, it's an advert, happens to click through to a dating website. And I'd have been kind of, if I clicked on that, I'd have been slightly conned, but I probably wouldn't mind too much. I'd just go back and move on. Then, more importantly, what happens here is recommended for you. I get a series of recommended for you. And this is where, if you like, the brains of Google gets going. So they obviously know something about me as a user. I probably did this through my work computer, so they don't know too much about me. But they'll know that I like watching TED Talks, so quite a few of these will be TED Talks that are coming through. This one here is a bit surprising. NVIDIA debunks conspiracy. Now, that's the kind of thing that gets thrown in. And why have they put that in there? You know, why would I be interested in either NVIDIA or the particular conspiracy that they're debunking that involves an astronaut? That's really quite far removed from Roger McNamee. Here I've got something about Spotify and antitrust. Well, it's maybe related. Here's another TED Talk. Now, the point is that Google, when they make the selection, they're choosing from several 100 million videos that they could show me. And last year, if you remember, I started with a slide about a chess match. And it was a chess match that used artificial intelligence from a UK company that Google acquired called DeepMinds. And what DeepMinds have illustrated their prowess by conquering the world of chess and the world of Go with these astonishingly human-like, players that surpass what a human could possibly do, but they do it in quite a human-like way. And the particular chess puzzle I put up there was kind of unsolvable for a human and involved sacrificing a piece, and 19 moves later and many millions of permutations later, 19 world-class moves later, getting the compensation for doing it. Well, that kind of intelligence, and this is what we often don't really see or not too aware of, that kind of intelligence is put to work in selecting what comes up here. Now, the importance of it, you might say, well, this is fairly trivial. There's nothing too threatening here. But the importance of it is this, that Google, with that sort of intelligence and the amount that they know about you and me when they do this, and Facebook too, and more, maybe more pertinently, because Facebook's been rather more caught up in some scandals to do with this, using that kind of level, that power of artificial intelligence, they have the power to influence what you think. And they do it in a way that is very subtle. And this is really where the discussion in Silicon Valley centers around. How do they do that? So what do they optimize their algorithms for that choose these things to select for you? And I guess in asking this question, publisher or platform, they want to argue very strongly they're just a platform. There isn't somebody in the background here choosing what I should watch next. They're not trying to propound a message. But increasingly, I'm convinced that this method that they're using is publishing. And the reason I think it's publishing is because these algorithms they use to choose are optimized. And what are they optimized for? Well, they're optimized for one very simple thing, to get you to click on as many things as possible. And the problem with that is that in clicking on, well, it turns out that the best way to do that, and they've tried millions and millions of ways, you can be sure of it, the best way to do that is to appeal to certain aspects which actually Roger McNamee calls the lizard brain. And what does he mean by the lizard brain? The lizard brain, the most consistent response you can get from any person, a human user, will be achieved if you strike one of two things. One is fear, and the other is anger. And if you appeal to those two things, you're very, very likely to get the next click. If you appeal to happiness, you might do. If you appeal to interest, you may do, but it's maybe not. And in practice, what goes on, and really the critique here, why does he talk about democracy being undermined? Well, the problem is that the way these algorithms are optimized, it turns out that you get the next click by showing somebody something that's just a little bit more extreme and a little bit more outlandish than the thing they thought they came to look at originally. And so they can't start by coming to see something quite innocuous, and they end up seeing something that is going to outrage them and is probably completely fictitious. And that is actually, this is where the nub of the problem lies. And so I ponder this really a lot, that when one thinks of recent developments politically around the world, and again, I'm not going to talk about Brexit, but we don't need to. Let's talk about some other places. What's happened in the Philippines? What's happened in Poland? What's happened in Czechoslovakia, Hungary, Brazil? These are countries which had really significant levels of freedom 10, 15 years ago, and now they have much, much diminished levels of freedom. Why is this being caused? And I was struck, I'm just going to throw one more thing into the mix here. I was struck recently when David Miliband passed through London to give the Fulbright lecture, I think this was last week. He was touching on maybe a related issue, and it's another way of describing the same point as to, should we be concerned about this or not? And the title of his lecture was The Age of Impunity. And I'm quoting him now, by the age of impunity, I mean a time when those engaged in conflicts around the world, and there are many, believe they can get away with anything, including murder, whatever the rules and norms. And because they can get away with anything, they do everything. Chemical weapons, cluster bombs, landmines, bombing of school buses, besiegement of cities, blocking of humanitarian supplies, targeting of journalists and aid workers. You name it, we are seeing it and seeing more of it, and seeing much less outrage about it and less accountability for it. Now, I find that a statement that's quite hard to deny. And then we scratch our heads, well, the internet was supposed to bring an age of increased transparency. We were 10 years ago thinking that democracy was about to flourish in many more places. We had the Arab Spring, we had the ability to communicate by mobile phones. What is it that has led us to actually feel a bit more blind than we used to? And this is why I'm raising this. And it's the other side, if you like, maybe the less optimistic side of every industrial revolution, of course, does some damage, and we have to then figure it out and try and repair and pick up the pieces. And so I think this is something that we do all need to be switched on to, and do our best as citizens to see this through to the next stage and you can't address the issues unless you understand them, is really the point. So to move on from this, what I wanted to do is recap some slides that I normally go through just to illustrate where we've come from as a VCT and where we've got to, and this is in a way reinforcing some of the points Anna made, because actually I think this is a remarkable transformation over a number of years. This is where the VCT stood in 2012, and for those of you who remember, what I'm showing here is the bubbles each represent a holding. The bigger the bubble, the bigger the holding, and what we have over here is a scale which is based on the market capitalization of those companies. How big are the companies? How much does the market value them at? And you can see our biggest one here, big holding, maybe about 100 million market cap. Most of them much smaller. Even the big holdings, probably 20 million, 25 million valuations. Some of them smaller than that. Some very tiny holdings in some companies that are probably worth very little and probably not doing too well. And this is how the progression goes. 2012, by 2015, you can see these bubbles inflating and rising, and the bubbles should rise, and we hope these bubbles rise as much as possible. So here by 2015, we start to have some, touching on 200 million, some big holdings, clearly achieving something, getting some recognition by the market, beginning to fulfill their potential. 2017, this is quite a transformation. Biggest holdings, 400 million, 300 million. This is already a completely different fund from where we were in 2012 in terms of liquidity, in terms of how much recognition these companies have, the audience they have on the market. And this is where we are in May 2018, so a year ago. And over that period, of course, the fund performed spectacularly well. But the holdings really were transformed. So keywords up here, over £1 billion a year ago. GB Group, 800 million. Learning Technologies, it's sagged back since then a bit, but it was 600 million. Accesso has also fallen quite a lot, reached a peak of 600 million here. Craneweb, these have become very significant companies. And many of them operating internationally, some of them globally, like Keywords, really a very global business. And this is where we are this year. It's a slightly different picture, but in essence, it's the same picture in that we have the core of the portfolio, the top 10 holdings, really in mid-sized, reasonably mature businesses. And this is, if you like, what relates to our strategy of wanting to run the winners. I think it's really very important for the VCT that we adopt this approach. It's allowed the VCT to grow into something much more investable, really, than one could have said 5-10 years ago. That said, of course, the VC has to continue to develop. And when we bring new holdings on, you can see them here. Some of these actually already become quite significant companies, £200 million market cap, which is CREO Medical's market cap. 5 years ago, that would have been one of the most valuable companies in the portfolio. Now it doesn't even stand out. So what I wanted to do beyond this is to go on and give you a little bit of a flavour of some of these newcomers to the portfolio, what's going on with them, why are we investing in them, is there a theme there? And there is a theme there, and if it's what I see is really the next phase of this industrial revolution that we talked about to do with digital technology that is beginning to come into its own right. It's also a very long industrial transition, and it's to do with healthcare. And healthcare, I think, is going to be one of the really big investment themes over the next 20 years. And it's because certain technologies that have been worked on for as long as I've been a fund manager, which is 20 years, over 20 years, are now coming into their own in an extraordinary way. And it's producing innovation which, having started in quite a dark place with this talk, I'll end in a very optimistic place, because I think what I really wanted to give you a flavour of with 4 companies I'm going to talk about is that they have technologies that are really important and going to make a huge difference in a number of areas of medicine. So the first one, CREO Medical, it's a company we invested in a couple of years ago, and behind CREO Medical lies a number of members who came out of a company called Gyrus, which back in the early noughties was very successful in London, and I'd observed it back then and admired it. It developed a surgical cutting tool that used RF technology for cutting instead of a blade, and you can get a much cleaner cut using radio frequency energy. And the inventor behind that company is somebody I regard as a bit of a genius, Professor Chris Hancock. And Jourdan got sold to an American company, and some of the team members, including Chris Hancock, resurfaced in CREO Medical. And this time around, Chris had added on a couple of extra whistles to this product. The most important thing he'd done with it is he'd miniaturized it. So Gyrus was really all about keyhole surgery, and keyhole surgery sounds really not, a big improvement on open cut surgery, and it is, but it's still pretty nasty. It involves 3 or 4 pretty substantial holes being made in the torso to have surgery, and you poke these rather rigid devices in. You have to go from a number of different angles. You have to, it's a big step forwards, but it's not the final answer. I think this is the final answer in what this does. This is miniaturized to the extent where you can put this tool inside an endoscope. And an endoscope is a tube, that flexible tube that you can, a surgeon can manipulate through the gut. So you don't have to make any incisions at all. So it's being used at the moment very widely, but mostly for investigative purposes. So you go and see, does somebody have bowel cancer? You can have a look. With this tool that CREO's devised, you can't just have a look. You can fix it. You can do all the surgery you need to do using this pretty amazing tool called the speedboat. And the speedboat has here, this is a needle, so you can inject fluid if you need to. You can't see all of this too much. You have bipolar electrodes. This is for the RF power. That allows you to cut so you can remove a bowel cancer from inside the gut using this tool, using RF, bipolar RF cutting. And you have a microwave. This is what's unique about the product. It combines microwave with RF. The microwave can coagulate, so you can cauterize the wound once you've made the incision. I'm not a surgeon, but I do believe this is a revolutionary piece of technology. I find it incredibly hard to believe that any surgeon seeing this would not think, crumbs, I want to have a go with this. The company's in the process of commercializing this. By coincidence, they made their first commercial sale yesterday. That's a big landmark. So they've been through approval. They've been through a long education process. They don't want to release this to the market and then find that people have accidents. So they've got to make sure everyone who uses it is very thoroughly trained, and they're very much controlling the release of this product. But I do think this is a very important device. It's really why we invested in this company. So I just want to give you the flavour of that. The next one, I'm going to fail to talk about this quite so easily. This is one of the drugs companies in the portfolio. Most of our medical investments tend to be more to do with devices and other aspects, but drugs are difficult. And Amrit, however, again, we're really backing a management team who we believe to be very skilled in this area. Amrit is a company focused solely on orphan products. So they're targeting rare diseases. And when we back them, we put in some money to allow them to progress a phase 3 study. So typically, when we make investments in these kind of companies, we're looking to invest late enough on in the process that we don't have to wait for years and years before the company achieves any revenues. And that time to market is very important to us. Amrit was in a phase 3. I won't bore you with all of the details of what they do, but this drug here, AP101, for a condition called EB, epidermolysis bullosa. It's a horrible condition. There's no treatment for it at the moment. If it becomes approved, next year it'll be the only treatment on the market. It's not really a treatment. It's more of it ameliorates the condition, but it doesn't cure it. So they have another product behind it, which is more of a cure. But importantly, the reason I wanted to talk about this company was they're in the middle of a reverse takeover at the moment. The shares are suspended. And if this completes, this will become a company with $130+ million of revenue, a market cap in the hundreds of millions of pounds. And this product here, you can see Lejuxta, where is it? Is on the market already. They have about 15, 16 million euros of sales. The reverse takeover will give them the US sales of the same equivalent product. So this, if you like, is taking a leap to becoming a much more mature business, and it's a very useful component of the portfolio. I'll try and speed up. Angle has a medical device called Parsortix, and Parsortix enables doctors to take a blood sample and filter out, if you like, this is what's going on here, is this is a filtering process. Filter through the blood to separate out any what are called circulating tumour cells, CTCs. So patients who have cancer, one of the indications of it is you have some tumour cells circulate in your blood, and these can be captured, but at the moment the only ways of capturing them involve killing them. The advantage of Parsortix is you can capture them alive and then you can analyse them. And this is called liquid biopsy, and it's it's an area where there's a huge amount of research going on. It opens up a very large number of possibilities for early diagnosis of a very wide range of cancers. So we're pretty excited about the potential for this and regard it as, again, a very important piece of technology. And finally, just one more stock to give you the flavour of a very recent investment in the portfolio, Polarean Imaging. Market cap is only about £15 million for this company. And these are all images of lungs. And at the moment, if you want to take an image of your lung to find out if it's working, you may well end up using something called scintigraphy, which was invented about 140 years ago, and it involves radioactive compounds that are put into your lung. So it has safety issues, and it will give you a black and white image, which will give you some pretty crude information about whether your lung is functioning. And all it will tell you is whether air is getting into the lung or not. What these images are telling you is air getting into all parts of the lung? Is some part of the lung not working? But also, does the oxygen that gets into your lung cross through the barrier, the epithelial barrier to get into the blood? So does it cross the barrier, and then does it actually get into the blood? It gives you way more information than's ever been available from looking at a lung image before, and it will do it in much, much higher resolution. So this device, again, is going to have, I think, a major impact on the areas, the medical areas to do with any kind of lung condition. And lung conditions are a huge area of medicine. So we're pretty excited about what this can do. And they put on a Capital Markets Day recently, which I went along to. And they're talking about how they can get different signature readings from these images, which will allow them very precisely, potentially, to diagnose different lung conditions just from an image. This has never been possible before. So we're pretty excited about it. It's not a well-known company yet. They're still at the stage of trying to get this imaging method approved. We think it's really not a high risk to get this approved. All they have to do is prove it's non-inferior to scintigraphy. And it's a little bit like comparing I don't want to advertise a car, but a Lamborghini to a Mini, say, and say, is that non-inferior? This is, it's a study that I think is highly likely to prove non-inferiority. And they do have some revenues already. They already sell the device for research purposes, but we don't think it's too far away from much more commercial revenues. So this is the kind of company that we're trying to bring into the portfolio. We think hopefully they will drive some of the big winners of the next 10 years. With that, I think I'm out of time. Thank you for your patience. I hope that's given you a flavour of why we're excited about the portfolio and some of our thinking around what's going on. Rachel, tell me, do we have time for any questions, or should we? If there's any questions, we could maybe take one or two quick questions if anybody has them. I'm not of the view that we should stop investing in oil and gas while we have demand. I am of the view that we should invest in whatever we can find to reduce demand. But that demand is going to go on for several decades, albeit hopefully reducing. Yeah. Thank you very much. We have the opportunity now to ask questions in private, chat to each other, have some refreshments in the foyer, following which there will be the Amati Guildhall Creative Entrepreneurs Award taking place in here. And I very much hope that any of you who can stay will come back and join us for that. Thank you.